Hi, David here at Reform Physical Therapy and Pilates in downtown Cleveland. This week we are talking about central canal stenosis. So what we're talking about with that is when the central canal, or the hole that the spinal cord runs through, starts to narrow and lose some of its width, there can be compression to those neurological structures. That can lead to pain that's not necessarily just in the back or even in the back, but feelings of pain down into the butt and down the legs. It can be really debilitating, and the pattern that we see for people that have this is that they want to be a little bit more forward because it feels better to be there versus being standing. It also feels better to be sitting rather than standing up and walking. So that, as a therapist, those are signs that I'm looking for. It's also something that we see in an advanced population, an advanced age population, rather than a younger population. So putting those puzzle pieces together, we can often diagnose this without even needing to see an X-ray or an MRI, even though those do help at times. So today, I just want to go over things I give people early that come in with central stenosis signs. So really, all I'm going to talk about is the fact that they like to be bent over, they like to be flexed, so that's okay. That's stuff that I give them to do. In therapy, it's pretty classically known that flexion or forward bend is something you can give someone with central canal stenosis and they feel better. So different versions of bending that I'm going to give somebody might be lying down. They're off their feet, so it feels a little easier for them. Just taking their knees, bringing them up, holding it for 5 to 10 seconds, and then releasing down. You'll see this as a pretty classic type of back exercise to do, but it's not appropriate for all back problems. Stenosis is one where it feels pretty good. Okay? Other versions, I'll just have people in sitting, whether it's on a chair or even on a bench, and just kind of have them bend forward, and they'll even get a little bit more flexion or rounding of that spine, opening up that canal and giving some space for those structures. Okay? This is also another population where I say, you know what? If you feel better in a little slouched position of sitting, that's okay. Stay slouched. We always say that you got to correct your posture. You got to correct your posture for back pain. For people with central canal stenosis, I actually don't really correct their posture very much. I might let them be rounded back because it feels better. To correct their posture actually causes sometimes some pain back into the legs. So it's okay if they're rounded. So when we're dealing with central canal stenosis, flexion or rounding of our spine is something we'll give some of our patients in order to just get some relief for those symptoms. So if you struggle with central canal stenosis or any other kind of back problem, come see us at Reform and we will help you get through it. Thank you.